Okay, we're gonna read now about vaccination. So we have five types of vaccination. We have a live-attenuated vaccine, kill or inactive vaccine. We have a group of immune, recombinant polysaccharide and conjugate vaccine. We have a toxid vaccine that comes from toxid, and mRNA vaccine, messenger RNA vaccine. So vaccinations, they induce an active immune response. It will be humoral or cellular to a specific pathogens. So vaccine induce an active immune response to a specific pathogens. So we have here the live-attenuated vaccine. Live-attenuated vaccine. This is a microorganism rendered non-pathogenic but remains capacity for transient growth within incubated host. Certain live vaccines like MMR, varicella, may be given to people living with HIV who have a CD4 cells more than 200 cells for millimeter cubicles. In consultation with specialists in infectious disease or immunity. So some vaccines, most of those live vaccines cannot be given by or pregnancy women or HIV patients. Remember, this is very hard yield questions because patients over 200 cells for millimeter cubicles can be vaccinated, but under the supervision of a specialist. So live-attenuated vaccine are microorganisms rendered. So in this case, rendered mean processed to clean the impurities, to clean the pathology part. So that means rendered or processed. So microorganism process for non-pathogenic but retains capacity for transient growth within incubated host. Certain live vaccines like MMR, like for example varicella, may be given to people living with HIV who have a CD4 cells more than 200 cells for a millimeter cubicle in consultation with specific infectious disease doctors. So the pros from this live-attenuated vaccine are these induce cellular and humoral response, induce strong and often lifelong immunity. That's the cons. So the cons, that's the pro. So they give you a long life immunity. They can induce long and strong immunity response. The cons are they may reverse to virulent form, so they can affect you, they can give you the disease. They are contraindicated when pregnancy ladies, patients with immunodeficiency. Okay, so patients immunodepression, like the patient with a CD40 HIV positive with CD40 less than 200, that's immunocompetency, immunodeficiency, pregnancy. So the more common vaccines that we have in this group are adenovirus, typhoid, polio, varicella, smallpox, BCG, yellow fever, influenza, MMR, and rotavirus. This is a group of vaccine that we have in this group. First group, remember, live-attenuated vaccine, adenovirus, typhoid, polio, varicella, smallpox, BCG, yellow fever, influenza, MMR, rotavirus. So This mnemonic is going to help you to remember. Attention teachers, please vaccinate small beautiful young infant with mRNA routinely. So let's see. Attention teachers, and we have here adenovirus for attention, adenovirus for attention, teachers, typhoid, teachers, typhoid, teachers, please, we have polio, please, attention teacher, please vaccinate for varicella, vaccinate varicella. Attention teacher, please vaccinate a small beautiful young infant, a smallpox for small, beautiful BCG, young for yellow fever, infant for influenza. So that reminds you that with MMR, so that's vaccine MMR, and routinely is for rotavirus. So you have the vaccines. This group we have adenovirus, typhoid, polio, varicella, smallpox, BCG, yellow fever, influenza, MMR, and rotavirus. Attention teachers, please vaccinate small beautiful young infant with MRR virus, MMR routinely. I think it is desired yield because I've seen questions about that live-attenuated virus, and they ask you about these patients was given a vaccine that was reduced in order to create a pathology in this patient, and then they ask you which one of the vaccines it was, so they had to pick from this list the correct answer. So again, adenovirus, typhoid, polio, varicella, smallpox, BCG, yellow fever, influenza, MMR, rotavirus. This is all the group of live-attenuated vaccine. So let's jump into the next group. It's going to be killed or inactive vaccine. Killed or inactive vaccine. Killer or inactive vaccine. They are pathogens. Is inactivated by heat or chemical. The pathogen is inactivated by heat or chemical. Maintaining the epitope structure on surface antigen is important for immune response, mainly induce a humoral response. So in this case, killer or inactive vaccine, the pathogen is inactivated by heat or for chemicals, but they maintain the structural for producing immunogenicity. So the positive thing for this kind of vaccine are they are safer than live vaccines. They are safer. But the cons are that they are weaker. They are weaker cells-mediated immune response, mainly induce a humoral response. They have to be needed boosted. So the cons are the boosted shots usually are needed. They are safer, but they are weaker. In this group we have hepatitis A, typhoid. In this group we have typhoid, like the live vaccine attenuated, but in this case typhoid is the type 21A and the oral. In this case the typhoid that we have is the V polysaccharide. So this is the different one, V polysaccharide intramuscular. B polysaccharide intramuscular. So we have in this type the rabies. We have the rabies vaccine, hepatitis A, typhoid, rabies, and influenza. Remember, we get the influenza every year in some countries, so you can remember that influenza is you get it every year, so that's remind you that it's attenuated and it's weaker. You're gonna need booster shot usually every year. Influenza, intramuscular. We have polio. In this case, the polio that is Salk, no the 7. So polio is in both. Polio is in live-attenuated vaccine and is in killed vaccine too. The type of polio that is in killed vaccine is the one Salk. Remember, a trip could kill you. A trip could kill you. A trip could kill you. Hepatitis A, typhoid, trip, R from the trip, influenza, I from the trip, and P from polio. So hepatitis A, typhoid, rabies, influenza, and polio. So this next group, I think it's very high yield too. I have seen a lot of questions about this kind of group: subunit, recombinant, polysaccharide, and conjugated. So we have here polysaccharide with conjugate protein. So this kind of vaccine all use a specific antigen that best stimulate the immune system. So it's for specific targets. So subunit, recombinant, polysaccharide, and conjugate all use a specific antigen that best stimulate the immune system. The pros are they target a specific epitopes of antigens, so they have a lower chance of adverse reaction. So they go specifically, they are chirurgic. There's some kind of vaccine that are more chirurgic, more straight. They target a specific epitopes of antigen. They are lower chance of adverse reactions. The cons are they're expensive, but they are weaker in immune response. They are weaker in immune response, and they are expensive. It's a whole process you have to have. Whole process. The group we have here, they have a vaccine specifically for hepatitis B antigen, specifically for hepatitis B superficial antigen. You can see here we have the HPV, the vaccine for HPV. We have a cellular pertussis. Let me see what kind of vaccine is that. So a cellular pertussis vaccine is the DTA or TD, Tdap. Okay, it's very common. DTA or TDAP. It contain purified component of the pertussis bacteria rather than the whole bacteria to protect against whooping cough. Those vaccines are part of the combinations vaccine that protects against diphtheria, tetanus as well. So while more effective than the whole cell pertussis vaccines in preventing disease, they may offer less long-term protection and have been linked to a greater risk of pertussis diagnosis of some studies. So this one, cellular pertussis, is like DTaP. It's like DTaP that we know, and it's for whooping cough. So we have the Neisseria meningitis. You have the vaccine for Neisseria meningitis. We have the vaccine for Streptococcus pneumoniae. It's called the PPSV23. So Neisseria meningitis, we have various strain. Streptococcus pneumoniae, that's the vaccine. Polysaccharide primarily T cells independent response. We have the PCV13, the PCV15, and the PCV20. They are polysaccharide produces T cells dependent response. This kind of vaccine is the PCV13. I have seen a question too. So this one The PCV13, also known as a PEPFAR 13, is a vaccine that protects against 13 types of pneumococcal bacteria. It is conjugated vaccine, meaning it's used specifically for part of the bacteria to stimulate the immune response. The PCV13 is a standard part of the vaccination schedule for infant and young children. So it's specifically for 13 types of pneumococcal bacteria. It protects you from against invasive pneumococcal disease, including pneumonia, meningitis, and bloodstream infections. So the PCV15, it is a 15-valent pneumococcal conjugated vaccine used to prevent pneumococcal disease in infants, children, and adults. It's part of the routine vaccination served in children under age 5 years old, and it's also an option for adults with certain underlying medical condition or risk. So the PCV20 or PEPFAR 20 is a pneumococcal vaccine designed to protect against 20 different types or strain of Streptococcus pneumoniae bacteria that can cause pneumococcal disease. It is recommended for children too, infant, children, and adults. I would say this is like the commercial part of the vaccines. So you can create vaccines with different kind of offers, like offer number one, offer number 2, offer number 3. So it's kind of look like that. I have a question that we're gonna find a question to read about this. So in this group, remember subunit, recombinant, polysaccharide, and conjugated. We have a specific, they are expensive, they're weaker, they're expensive, they're more specific for certain disease. Remember, we have for hepatitis B, for HPV, we have for Neisseria meningitis, we have for PCV13, PCV15, PCV20. We have for whooping cough. They're all T-cell dependent response. We have the zoster 2, the alpha zoster vaccine, and the immune. And last but not least, the Haemophilus influenzae. So the Haemophilus influenzae vaccine protects against Haemophilus influenzae type B disease. It's a serious bacterial infection that can cause meningitis, pneumonia, and other serious illness in young children. This vaccine is highly effective vaccine and is recommended for all children under 5 years old according to the CDC. The HIP or Haemophilus influenzae type B. Haemophilus influenzae type B. So Haemophilus influenzae type B, helper zoster vaccine. Remember helper zoster vaccine. The PCV13, 15, and 20. We have all this kind of like it's some like immune, like a group of vaccine specific for a specific disease. So in the next group we have the toxid. The group the toxid, they are denaturate bacterial toxin. So this group of bacteria, they grab the toxin of the bacteria, and they do denaturation. They denaturate bacterial toxin with an instant receptor binding site. So they still work. So they denaturate the toxin, and then this toxin stimulates the immune system to make antibodies without potential for causing disease. So remember, the toxin are dangerous. The toxin is a product of bacteria, and they are can damage our body. So they denaturate the toxin, the bacterial toxin, and it still produce immune system stimulation. So the pros of this kind of vaccines are they protect against the bacterial toxin. They protect us against the bacterial toxin. The cons are antitoxin levels decrease with the time. So it's necessary to have boost shots. It's necessary to have booster shots. In this group, we have the Clostridium tetani and Corynebacterium diphtheriae. There's two vaccines, Clostridium tetani and Corynebacterium diphtheriae. The last group that we have is the messenger RNA. It's a lipid nanoparticle delivers messenger RNA, the RNA, causing cells to synthesize foreign protein, for example, spike protein in the SARS virus. Again, a lipid nanoparticle delivers messenger RNA, causing cells to synthesize foreign protein. For example, spike protein from the SARS virus CoV-2. The pros of this group is their high efficacy, induce cellular and humoral immunity. They are safe in pregnancy, like the COVID vaccine was safe in pregnancy. The cons are the local and transient systemic. They can give you fatigue, headache, myalgia. The reactions are common. The rare are myocarditis, pericarditis, and particular in young males. The vaccine that we have is the SARS-CoV-2, the COVID vaccine. It's one of those type of vaccine. Let's see a question now about this. So we got these questions. It's a 6-month-old boy is brought to the clinic by his mother and grandmother for a routine well-child visit. The child was born full-term and has no medical problem. He recently learned to sit and support and setting up to eat poor food. So vital signs and physical examination are normal. As part of the routine pediatric immunization schedule, the pneumococcal conjugated vaccine is ordered. The patient's grandmother said that she recently received the pneumococcal polysaccharide vaccine. Which of the following statement is true regarding the difference between the pneumococcal conjugated and the polysaccharide vaccine? So the options that we have, the conjugated vaccine causes less local size reaction than polysaccharide vaccine. The conjugated vaccine induces more robust immune response through B and T activation. The conjugated vaccine is activated while the polysaccharide vaccine is live-attenuated. The conjugated vaccine protects against meningitis, but the polysaccharide vaccine does not. The conjugated vaccine protects against more pneumococcal strain than the polysaccharide vaccine. Which one do you guys pick? And the answer is the conjugated vaccine induces more robust immune response through B and T cell activation. So as you can see here, the conjugated vaccine give you more activation of B and T cells together compared to the polysaccharide vaccine. The only B cells is in process here, so you can see B cells and T cells activated too. Let's read. So you can see in the polysaccharide vaccine you have moderate levels of intermediate infinity antibodies. In the other side, the conjugated vaccine, you can have high levels of elevated levels of high affinity antibodies with memory cell formation, as you can see here better. So let's read about that. So, Streptococcus pneumoniae is a common cause of invasive infections, for example, meningitis and sepsis in children, particularly those under the age of 2. Routinely, childhood immunization has dramatically reduced the incidence of Streptococcus pneumoniae infections in infancy. So, the pneumococcal strains are identified by the polysaccharide protein or component on their capsula. Those polysaccharides are included in vaccines to provide strain-specific immunity. So The two types of pneumococcal vaccines are polysaccharide and conjugate vaccinates. The two types of pneumococcal vaccines are the polysaccharide and the conjugated vaccine. The 23-valent pneumococcal polysaccharide vaccine, the PPSV23 pneumovax, protects against a wide range of serotypes, but antibody levels decline over approximately 5 years. In addition, the PPSV23 is not immunogenic in children aged under 2 due to their relatively immature human antibody response. Therefore, the PPSV23 is recommended for all adults aged over 65 and for those aged from 2 to 64 with certain medical conditions, for example, diabetics, chronic pulmonary or cardiovascular disease. Those from 2 to 64 are recommended for this. So polysaccharide vaccine. Then the 13-valent pneumococcal conjugated vaccine. This is a conjugated vaccine. The PCV13 of Pfizer contain a non-toxic diphtheria protein conjugated to the polysaccharide that boosts the immune response through T cells recruitment. The conjugations allow for development of memory B cells higher and longer lasting antibodies levels and less mucosal carriage. Therefore, the PCV13 is strongly immunologic in infancy and part of the routine childhood vaccination. Similar to the PPSV23, the PCV13 is recommended for immunocompromised patients and adults aged over 65. So I would say that PCV13 is more strongly for children and is recommended for immunosuppressive patients over 65. So education objective is pneumococcal conjugated vaccines are strongly immunogenic in infancy due to both B and T cells recruitment. They provide higher long-lasting antibody titers related to pneumococcal polysaccharide vaccines. The pneumococcal polysaccharide vaccine is poorly immunogenic in infants due to their relatively immune humoral antibody response. So remember, there's two differences. Pneumococcal polysaccharide is different than pneumococcal conjugated vaccine. Pneumococcal conjugated vaccine are strongly immunogenic in infants due to both B and T cell recruitment. They provide higher long-lasting antibody titers related to pneumococcal polysaccharide vaccines. On the other side, the pneumococcal polysaccharide vaccine is poorly immunogenic. The pneumococcal polysaccharide is the number that we call the PPSV23. So the PPSV23 is not immunogenic in children under the age of 2. Remember, because they have immune system very weak yet. This one is recommended for adults over 65 with weak immune or medical conditions. So other side, the 13-valent pneumococcal conjugated vaccine, the PCV13. Remember, the lower number is for the lower kids. The lower number is for the kids. The bigger number, 23, is for adults. I hope that helped you. Thank you, guys.